Today, here's the second part of the lecture on the surgeries on the ruminant teat and mammary gland. I will be showing you my past surgeries on udder laceration in cattle and hemi-mastectomy in cattle and goats. For our objectives, you are expected to do patient preparation properly, for you to decide the appropriate surgical procedure for mammary surgery, for you to perform without complications and discuss the selected mammary surgery, for you to identify the possible complications coming from the selected mammary surgery, and finally, for you to instruct the caretaker on post-op patient management. Let's start with some relevant anatomy. So the udder is well vascularized by the large pudendal vessels in the inguinal area. Let's emphasize on number 5, which is the external pudendal artery, extending to number 6, the cranial-mammary artery, which are the main vasculature involved in hemi-mastectomy. Furthermore, the udder is suspended from the flank and via the median suspensory ligament rather than being attached to the ventral body wall. This was my cattle patient which suffered from udder perforating laceration of the left hind udder. So go back to part 1 of this lecture to understand how this surgery will be done to address this udder laceration. And this is an emergency surgery that has to be done not more than 4 hours from the accident or the trauma so that it will have a good prognosis. Furthermore, I have another cattle patient here, and figures 5 to 6 are showing us gangrenous mastitis on right-hand udder of a Holstein Sahiwal cattle. And we can imagine how foul-smelling this case is because we see a lot of pus coming from the teeth of the cattle patient. Removal of the gangrenous mastitis resulted to the swollen alveolar duct coming out from the hole made by the severe mastitis. In reference to figures 2 to 3, emphasizing on picture B, we see this alveolar duct system that is now swollen and has protruded from the hole made by the severe mastitis. I have another patient here. This is a goat which happened recently. And this goat suffered from severe environmental mastitis, resulting in swollen right udder 2 days after feeding. The progression of this case is showing us the extensive dead mammary tissue 2.5 weeks after feeding. And over 1 month, this dead mammary tissue freely detached itself from the remaining live mammary tissue to show us this, figures 19 to 21. And same as the cattle patient shown earlier, we are now being shown extensive swollen alveolar duct system. This patient was actually operated on last week, and part of the patient preparation was putting her on lateral recumbency and lifting the hind leg to expose the surgical site, and hair clipping was done surrounding the right udder. This is another patient showing you this was on a standard bower, and the severe mastitis happened on the left udder. 4 corneal draping was done to isolate the left udder from the rest of the body. In relation to part 1 of this lecture, you can sedate the patient, and that will be on lateral recumbency. So figure 25 is showing us that cattle patient tested on general anesthesia on left lateral recumbency to expose the right hand udder to be operated on. And for the coming slides, so this is how we did the hemi-mastectomy surgery in that cattle and on the goat patient. So there was vertical incision on the cattle and falciform incision on the goat patient to extend the opening of the tooth wound. This is a video clip of how this step was done. Next, The right hand udder for the cattle patient and the right udder for that goat patient was bluntly dissected to detach the mammary tissue from the inner skin wall. After clamping and ligation, the detached mammary tissue was removed. And excess skin was removed to oppose the end style. Make sure not to leave any dead space inside. Do also a subcuticular suture pattern as much as possible before doing or appusing the skin using a simple interactive suture pattern. This is an additional material for you, a video on a goat mastectomy done in a field setting. For the post-operative management, first, tetanus toxoid was given after the surgery, especially if the patient doesn't have an updated tetanus vaccination. Non-steroidal anti-inflammatory drug medication was given for at least 3 days, coupled with an antacid to prevent any acidification of the rumen. Antibiotic medication was done for at least 7 days to up to 12 days. There is an importance to limit the mobility of the patient, so to prevent suture dehiscence. Daily wound management should be properly done to prevent any wound infection, and suture removal can be done as early as 10 days to 14 days. So figure 26 is showing us the application of a genuine tube on the cranial part of the incision site and the application of a fourth interlocking continuous suture pattern to close the skin after mastectomy of a left gangrenous mammary gland in a dome. Complications, we can start with the most common but of less or minor effect would be the suture dehiscence. And this is very common as shown in figure 27. And this occurred after a week as the cattle patient is very mobile and still being milked twice a day. That's why this suture dehiscence was very common for this cattle patient. Seroma formation may happen if there is any dead space left inside, and also pus formation can readily happen if the surgical site was not properly attended to on a daily basis. For the complications that could happen in the cattle patient, these were managed by wound cleaning and intended for secondary healing until the wound closed in 2 weeks. So this is the list of references that were looked into in preparing this video lecture. Thank you.